For many people, springtime is a great time to jumpstart healthy living and visit the doctor for a checkup. Healthy living is also important if you're living with digestive issues from Crohn's disease, ulcerative colitis, or celiac disease, because you may also have an associated condition called iron deficiency anemia. Mm-hmm. I'm pleased to be talking today with Dr. Rye to explain the causes of iron deficiency anemia and ways to manage it with your health care provider. Mm-hmm. Dr. Rye is medical director of the Gastro Center of Maryland and Cascades Endoscopy Center. Iron deficiency anemia is the most common nutritional deficiency worldwide. So now, Dr. Rye, what is iron deficiency anemia?
Thank you for having me, Dr. Goodwin. IDA stands for iron deficiency anemia, which is, in a nutshell, a deficiency of iron in the body. Iron is part of this protein called hemoglobin, which is a key ingredient of a healthy red cell, and which is what carries oxygen throughout the body. If you have iron deficiency, you're essentially starving the body of healthy oxygen, and there's a lot of downstream sequelae and complications from that. But nutritionally, it is one of the most common deficiencies worldwide. And iron deficiency anemia, we believe, affects about 5 million people in the United States alone.
I see. And and I gather these digestive diseases that I've mentioned are associated with iron deficiency anemia?
Yes. Again, you don't have to have a disease to have iron deficiency anemia. It could just be somebody who went on a health kick and went vegan or vegetarian and didn't realize they're not getting sufficient sources of iron in their diet. Or it could be somebody with a medical condition like we talked about, Crohn's disease, ulcerative colitis, celiac disease, which is a genetic disorder that affects the villi, the intestinal wall that absorbs the iron is damaged. And then there are people with chronic kidney disease, cancers, but women in general tend to be far more at risk for iron deficiency, and women of childbearing age can be, about 20% of them can be iron deficient with no disease of any kind.
I see. So what would you say are from a percentage standpoint, the major causes of iron deficiency anemia?
Yeah, so the iron deficiency can come from 3 separate things. So it can come from not having enough iron in your diet, which is something we see in certain forms of, again, geographically it can vary, and depending on people's diets it varies. But then you can also have it from bleeding. So it could be somebody who has a stomach ulcer or Crohn's and colitis. There's 2 or 3 million people with these conditions, and they have chronic internal bleeding that they don't even realize sometimes because it gets mixed in with the stool. And then we have people who have the absorption issue, and that's people with celiac disease, even people who take antacids or other medications that interfere with iron absorption. And then there's inflammation of any kind. And so there's a lot of different factors that play a role in iron deficiency anemia. I'd say the most common cause would be somebody who has essentially some form of internal bleeding.
I see. All right. That's helpful information. Can you tell me if it affects certain patient populations?
Yes, Dr. Goodwin, it affects women disproportionately. So, as I was mentioning, it can be as high as 20%. 1 out of every 5 women in the childbearing age can be iron deficient, and it's part of the, menstrual bleeding can contribute to that. But in other conditions, it has to do with the absorption and the very subtle blood loss that we talked about with Crohn's and ulcerative colitis that occurs on a daily basis.
And what are the symptoms of IgA or iron deficiency anemia?
At the very beginning, it can be very subtle. Somebody may just feel a little bit tired or fatigued, but as it progresses, they start to develop shortness of breath, and again, in an individual, no two people look the same with iron deficiency. Somebody may have like this craving for something like ice, which is called pica. They could have hair loss, they could have brittle nails, they could have subtle things like that. But then eventually, when it gets more severe, people can be extremely short of breath. They can be dizzy, pass out. They can have chest pain, palpitations. All of those things can happen, and it can end up with somebody going to the emergency room to get a blood transfusion, which we are trying to avoid today.
Right. And how do you test for iron deficiency anemia?
So the goal today is to raise the awareness about this disease condition on behalf of Daiichi Sankyo, so that people can proactively approach their physicians and tell them about these symptoms, get the appropriate testing, and that allows us to catch it at an earlier stage where you can have easier treatments that can be done. So the testing is actually quite simple. There is a complete blood count that can be done to look for the hemoglobin levels, and then there is an iron profile that looks at ferritin and something called transferrin saturation. Again, very simple outpatient blood test that can be done.
I see, okay. And how is it treated?
So the treatment approach is based on, again, the severity of the iron deficiency anemia as well as the patient profile. So it's important for the patient to get in touch with their physician, come up with a plan. It usually starts with fixing the diet to get some healthy sources of iron, adding some supplements, and if that doesn't work, or if patients can't tolerate oral supplements, then there are some very nice new forms of intravenous or parenteral iron therapy that are now available. Some of these are a quick 30-minute infusion in an outpatient setting in a doctor's office, and within 7-10 days, you can essentially replete the entire deficit so that for the next many months, years, patients can be completely, their iron deficiency can be fully corrected.
Okay, and essentially, I guess one can say that the key part of treatment is taking care of whatever caused the iron deficiency anemia.
Absolutely. We want to fix the underlying cause so that in a few months or a few weeks, the same problem does not recur. But typically what we notice is that if you have somebody with Crohn's or colitis, for example, and we treat their Crohn's and colitis with a biologic or steroids or something like that, it can take 3, 4, 5 months for the disease to go into remission, and it may take another 3 or 6 months for the iron to be fully restored. So we don't usually wait just to treat the underlying problem. We also try to fix the iron deficiency concurrently so that they can not suffer for many months until their body can actually absorb it on their own through the diet.
So it's a combination?
Absolutely, it's a combination.
Okay. That was very helpful information. I'm sure my Health Power audience will benefit from learning much more about iron deficiency anemia. And I want to thank you for sharing this information with us.
Thank you for having me, Dr. Goodwin. And there is a website called getironinformed.com.
Okay, hold on. Let's get that.
Getironinformed.com.
Getironinformed.com.
That has a lot of useful information about what we talked today.
Oh, that's good to know.
Thank you so much.
So that's, of course, www.getironinformed.com?
That is correct.
Okay, thanks for that information also. Have a good day, and I enjoyed talking with you.
Thank you for having me, Dr. Goodwin.
Okay.
Thank you.